Good afternoon, everybody, and welcome to our virtual Multicultural Mental Health Forum. My name is Hayriye Uluca, and I'm an Australian Multicultural Ambassador for the Mental Health Foundation Australia and the Chair for the Victorian Committee. On behalf of Mental Health Foundation Australia and our Chairperson, Mr. Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending our virtual Multicultural Mental Health Forum today. We begin today's proceedings by acknowledging the traditional custodians of the land on which we live and work, and the Mental Health Foundation Australia would like to pay our respects to their elders past, present and emerging. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health. It's an important time where the Australian community comes together to raise awareness that mental health matters. The MHFA's National Mental Health Month in October of every year is unlike any other mental health campaign. It aims to bring all Australians together through a series of various mental health related events. This program that the Mental Health Foundation of Australia is extremely proud of is one that we intend to utilise to reach out to and educate as many Australians in Australia as possible. And that's really to help reduce the stigma and facilitate positive and non-judgmental discussion surrounding the importance of mental health in Australia. We have many events that have been arranged in each state and territory, and that's really to attract and unite Australians of all ages and backgrounds, and in particular to raise awareness of better mental health resources and to promote constructive discussion about multicultural mental health in Australia. We've engaged with many heads of state in the multicultural space. I'd also like to make a quick mention of the Multicultural Mental Health Survey developed by Mental Health Foundation. MHFA believes in outcome-based solutions, and hence we've created this Multicultural Mental Health Survey to go out to Australians in the community. And the purpose is to gather information about culturally and linguistically diverse communities in Australia and prepare recommendations based on the feedback to be sent to local, state and federal levels of government about what's required in this area and how we can reduce and break down the barriers so that people can access the resources and the support that they need, and we can break down the linguistic and cultural barriers that might be in place. You can find the link to this survey on the MHFA website or by contacting us via email at admin@mhfa.org.au. I now invite you to please join us in celebrating the Mental Health Foundation of Australia's 90th anniversary and our journey throughout those 90 years by viewing a short video.
A journey of 1,000 miles begins with a single step. Mental Health Foundation Australia's journey began 90 years ago. It dawned in 1930 with just a founder and vision, which was to reach and impact Victoria. Now we have a presence in all states and changing lives for over 100,000 people throughout Australia. Our organisation's biggest initiative yet is our National Mental Health Month. Our month-long initiative is to advocate and raise awareness on Australian mental health. Our vision is to recharge and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With the theme being Mental Health Matters, the awareness is cumulative. In 30 events we have organised to reach the community in all mental health subject matters affecting our lives today. To further continue our journey of 1,000 miles, the Walk for Mental Health has transitioned from a Victoria-only walk to being a nationwide community walk, where anybody from anywhere in Australia can connect with us and walk with us virtually to spread the impact and awareness of mental health. We pride ourselves with making sure all our programs are for the community and are powered by the community. We have a vast growing network of multicultural ambassadors who are part of our program to further the community voice in promoting positive mental health and wellbeing. Our multicultural network has inspired our educational and multicultural webinars as an initiative to help power Fidelity to cope with success during the pandemic, to promote the understanding of unique cultural and ethnic heritage in Australia, and the development of culturally responsible and responsive curricula. The Mental Health Foundation of Australia conducted the multicultural research to continue on the development of the fast-growing multicultural fidelity in Australia. With the effects of COVID-19 pandemic, the MHFA has successfully committed the Power Hour of services and the reach to the community. With the helpline hours extended, we are here to show Australians we can be a shoulder to lean on and can be dialed to assist in all mental health matters. Our impact flows into the COVID-19 meal delivery response with the help of the community, local business and our multicultural ambassadors. It has promoted one vision, which is to serve others before self during this time of uncertainty.
Hi, Aisha.
With over 45,000 meals delivered, we continue to work with the Department of Health, the Human Services, the Salvation Army and the Australian Multicultural Foundation to continue this success. As we continue to work to deepen understanding the importance of mental well-being and educating the community, let's work together to bring better mental health for all.
Thanks for your attention during that short video. Before I introduce our esteemed guests, I'd like to say a few words about the importance of keeping the discussion about mental health alive, particularly in the context of the multicultural community and culturally and linguistically diverse people. I was Australian born, but I am the child and grandchild of migrants on both sides of my family from Northern Cyprus, and we're from a Turkish speaking background. And on one side, the move to Australia, the migration was for economic reasons. On the other side, it was also due to war. And I think that one thing that I've learned in my sort of upbringing and also in my work that I do every day in engaging with people from culturally and linguistically diverse backgrounds is that this topic of mental health isn't really a live conversation in most households. And in fact, despite the experiences and struggles of my grandparents, I didn't really ever recall much discussion about mental health or there being an emotional response to the struggles that a person had gone through, or even, from experiencing war and having to leave and find a new home in a foreign country where you don't speak the language. I think it says a lot about the way that certain communities view mental health issues, and there is a perceived stigma that we still need to break down. And I think that shifting the focus to looking at perhaps exposing the fact that you need some help is a sign of strength and not a sign of any weakness. And so I'm really excited to engage in discussion with our esteemed panelists today and hear from our keynote speakers who can provide some insights from both their personal and also their professional lives. I now want to invite Mr. Hass Mustafa OAM, who is a director of the Mental Health Foundation Australia. He is someone who I know very well, and I'll leave it to you to join the dots. He's a very proud Australian with a Turkish Cypriot heritage, with a very humble beginning, who migrated to Australia with his family 52 years ago at the age of 10, at a time when you were expected to assimilate into the Australian way of life and not be different. Multiculturalism was not promoted then, and he had very little support to learn the English language. Huss, under these very difficult circumstances, was able to, in just 5 years, learn the language, pass his grades, and at the ripe old age of 16, obtained his first job at the then known State Bank of Victoria, which merged into the Commonwealth Bank in 1991. Huss is the longest standing senior executive at the Commonwealth Bank with 46 years of service, of 18 years of which have been as a general manager for the business. He's now the general manager of Multicultural Community Banking in Australia, a division that he initiated in August 2016. Huss also represents the Commonwealth Bank on the Queensland Multicultural Ambassador Program and for over a quarter of a century now has been very active in promoting cultural diversity, both in the community and his workplace. And his work was also acknowledged on the 2014 Queen's Birthday Honours List. And he was awarded an Order of Australia Medal for his services to multiculturalism and business. Please join me in welcoming Mr. Hass Mustafa.
Thank you so much, Hayriye, for that very generous welcome. I think it's the first time that I've been introduced by my daughter, so thank you so much for that. Can I also begin by firstly acknowledging the traditional custodians of the land that we are on today, wherever you may be. And today I am on the land of the Wurundjeri people of the Kulin Nation, and I take this opportunity to pay my respects to their elders, past, present and emerging. Can I also acknowledge Viv Nguyen, Chairperson of Victorian Multicultural Commission, Professor Sev Ozdovsky, AM, Chair, Australian Multicultural Commission, Professor Hayriye Minas, Head Global and Cultural Mental Health Unit, University of Melbourne, Sonia De Mezzo, Deputy Chair, ACT Multicultural Advisory Council, and Dr. Edwin Lotus Joseph, President Multicultural Council of the Northern Territory, and all participants of today's virtual forum on multicultural mental health. On behalf of the Chair, all the staff of Mental Health Foundation of Australia, thank you so much for attending, and I'd like to welcome you all to today's Multicultural Mental Health Forum on day 20 of the Mental Health Foundation Australia National Mental Health Month campaign for 2020. The National Mental Health Month, as Hayriye mentioned, is a program that the Mental Health Foundation Australia is extremely proud of, and we intend to reach out to and educate as many Australians as physically possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health due attention. And that is exactly what Mental Health Foundation Australia is aiming to achieve. It is also important to note that mental illness does not discriminate against culture. And today's event has been organised to discuss and create an awareness of mental illness in multicultural communities and to explore how we may be able to eliminate the stigma attached to suffering from mental illness in multicultural communities. I firmly believe that a person suffering from mental illness shouldn't be treated any different than if you were suffering from asthma or diabetes. Multicultural mental health is an important facet of mental health. Australia is one of the most multicultural countries in the world. And if I may add, in my personal opinion, I think it's the most successful multicultural nation in the world, with cultural landscapes having changed significantly over the last decade or so, with many emerging communities. Having this in mind, it is important for the mental health sector to provide targeted approach and appropriate services for culturally and linguistically diverse communities. Migrants might face difficulties in gaining employment, integrating into the Australian way of life and environment, and a lack of support services in turn affecting various aspects of their lives. Unfortunately, we see anxiety, depression, and other mental health concerns being very visible in multicultural communities. It is during events like this where we can discuss the barriers faced by CULT communities in supporting their mental health to improve the support available to those who really need it most. I am also very proud of the establishment of the MHFA/CBA Multicultural Ambassador Program, which is supported by the Commonwealth Bank, an organisation that is committed to supporting multicultural communities. The Foundation has now a multicultural ambassador network of over 500 individuals across the nation, including around 70 CBA colleagues, to facilitate this task of tapping into multicultural communities. And I commend the work of our multicultural ambassadors in spreading the MHFA's message of better mental health for all, especially within their own multicultural communities. In concluding, I congratulate the Mental Health Foundation Australia for organising today's event and thank all our speakers and participants in being involved and contributing to making a real difference in the mental well-being of many Australians. And I now pass it back to Hayriye to continue with today's proceedings. Thank you so much.
Thank you, Huss. I would now like to welcome Dr. Nancy Huang, Chief Medical Advisor IAL from Australian Unity, to say a few words as the MHFA's major sponsor for National Mental Health Month 2020. Nancy has a broad range of clinical, public health, research and implementation experience within the health and aged care sectors. Nancy's passion is to reduce evidence practice gaps in healthcare delivery with a focus on prevention, early intervention and integrated care. Nancy is the Chief Medical Advisor for the Independent and Assisted Living platform of Australian Unity, overseeing the clinical governance of care to deliver outcomes that matter for their customers. Nancy joined Australian Unity in 2015 as Clinical Director of Remedy Healthcare and took up the role of CMA in 2019. Prior to joining Australian Unity, Nancy has worked as a general practitioner in the community and led a number of large, innovative and popular health initiatives on behalf of government, universities and not-for-profit organisations. Her previous roles include the establishment of Medicine Insight, a large-scale national data repository collecting general practice data from desktop software, Director of the Guideline Research Program at NHMRC, National Manager of the Clinical Programs at the National Heart Foundation of Australia, and the key architect of the Active Script and Life Scripts program for the Commonwealth Government. Additionally, Nancy held an appointment as Adjunct Professor in the School of Health and Social Development at Deakin University from 2015 to 2019, and was the Director of Vincent Care from 2014 to 2019, established to support and advocate on behalf of the most disadvantaged Victorians. Please join me in welcoming our very esteemed guest, Dr. Nancy Huang.
Thank you very much for that. Hello, everyone. Good afternoon. I would like to also start by acknowledging the traditional owners of the land on which we are meeting, and I pay my respects to their elders, past and emerging. I want to offer also my condolences to those who've been affected or lost loved ones since the beginning of the COVID-19 pandemic. My thoughts and support go out to all those families, and I also acknowledge the impacts of COVID-19 on other countries close to Australia and the challenges they are facing. So, as you've heard in the introduction, I'm the Chief Medical Advisor at Australian Unity. I am also a first-generation immigrant from Taiwan. I came to Australia at the age of 8 with my family. We were one of the first families from Taiwan to migrate based on a skills migration scheme, as my father was an electrical engineer. My first language is Mandarin Chinese. And it's a real honour today to be here on this panel with so many eminent speakers. I want to also acknowledge the sponsor, Mental Health Foundation Australia, and the great work we've just heard about that they are doing in the mental health space. This is Australian Unity's second year of involvement with the foundation, and we look forward to tackling some of the most challenging social issues together. Mental Health Month, held in October each year, is really a great opportunity for us to raise awareness about mental health and wellbeing and promote ideas to improve the daily lives of everyone. I would like to also welcome you to the forum and congratulate you for taking this opportunity to promote activities and ideas that can have a positive impact on our community. As you are all aware, and very fortunately for me, Australia is one of the most culturally diverse nations in the world. The spotlight since COVID-19 has confirmed that we have to prioritise services and programs specifically tailored to meet the mental health needs of our culturally and linguistically diverse communities. Organisations such as Mental Health Foundation Australia are doing valuable work to both research and advocate for better care for all Australians. There is much work in this area, including better access to evidence-based services for diverse communities and closing the gap for between Indigenous and non-Indigenous Australians. As a nation, we need to improve together our efforts to address these inequalities and barriers for people to access care for mental health. We need to not just close the gap, I think, but also to exceed the gap for all. In terms of this year, the outbreak of COVID-19 will likely have long-term and profound impacts on Australia's physical and mental health. This is a particular challenge for multicultural communities, as it already has shed more light on the barriers to care, such as access to useful information, the appropriateness of our mainstream health services, and associated feelings of isolation, understanding cultural norms, trust or respect for government advice, and for some experiences of racism or exclusion and stigmatisation of mental illness. Many studies already are showing increased rates of worry, anxiety, depression in the general community. While government has committed to funding more services in response, we need to collectively be vocal about whether these are meeting the needs of community groups who are less resourceful or literate in English, or have different cultural norms in help-seeking behaviours. One relevant area I would like to call out is this nexus between mental and physical health. In Australia, the high community burden of anxiety, depression, suicide, self-harm actually sits alongside of heart disease, cancer, respiratory disease in prevalence and incidence. Indeed, there's now a lot of research to show that the link between mental and physical health goes both ways. A person with mental health conditions can have shorter lifespan, usually due to a concurrent chronic physical condition that hasn't been well managed. Additionally, a person with chronic physical conditions such as heart disease also has a much greater risk of mental health issues such as depression or anxiety. So added to that, the specific barriers for multicultural and Indigenous communities I mentioned earlier, it creates this mounting challenge for people to receive the right care when they need it the most. These complex needs of diverse communities, especially with the new pandemic challenges, are some of the mental health issues that the Foundation and Australian Unity are facing into. At Australian Unity, wellbeing is at the heart of everything we do, and we've been providing services for over a decade to help our members better manage their chronic physical conditions. Our focus is increasingly now around how to integrate this care for the individual. So about 20 years ago, the Deakin University worked with Australian Unity to develop the National Wellbeing Index that measures satisfaction with life across a number of areas, including standard of living, health, achievements, personal relationships, safety, community connection, and future security, to produce a holistic view of Australia's wellbeing. This has provided inputs into our understanding of factors that influence wellbeing and has informed planning and policy making for our communities. Additionally, a new mental health program, MindStep, is delivered by Australian Unity. After conducting a global research in 2015, we adapted the UK's National Health Service model of low-intensity cognitive behavioural therapy for people with depression or anxiety. This serves to reduce access issues by enabling people to recover and stay recovered in their own homes. With these good recovery rates, MindStep now is being adapted to a program called Healing Minds, which was co-designed with and for Indigenous people experiencing depression or anxiety. We also plan to adapt this for culturally and linguistically diverse communities to respond to the growing needs of services that are proven to work. So in conclusion, we have all been touched by mental health concerns. Mental Health Month is really an important opportunity to raise awareness about the impacts of mental health and mental illness and the range of supports that are available that can improve someone's sense of well-being. For me, this has been an important driving force professionally, but also personally. Working as a doctor in Australia, I have witnessed some great developments in mental health care over the last 35 years. However, some worrying gaps remain, which I have experienced recently as a daughter. For over 12 months before my father passed away last September, we tried to find culturally appropriate care for him after he suffered a stroke and then subsequent depression. His English regressed and his pride with it as he struggled to complete simple daily tasks. Ultimately, after 3 false starts, we finally found a care team that was able to meet his needs. But there was a heavy burden and toll on my mother and the rest of the family. So I am committed to ensuring that we maintain a focus on innovating and tailoring services and programs that are grounded in evidence and have long-lasting, meaningful impacts to people's mental health. This means that sometimes one size will not fit all, and as providers of care, we have to continue to ask the most important question of all, which is, what matters to you, rather than just what's the matter with you. So at Australian Unity, we will continue to work with the Mental Health Foundation Australia to identify service gaps. It's an important and exciting partnership for us that can really add value to what we do as individual organisations. And I thank the Mental Health Foundation Australia for their unwavering commitment to improve better mental health for all Australians. Thank you very much.
Thank you, Dr. Huang, for your very insightful address. And I think a very encouraging thing to say at the end of your address, that it's important to focus on what matters to you, not what's the matter with you. I think it's such an important thing to remove judgment from the way that we speak with others. So thank you for your address. I'd now like to invite our keynote speaker for today, Professor Hayriye Minas, who is the head of the Global and Cultural Mental Health Unit, Centre for Mental Health and Melbourne School of Population and Global Health at the University of Melbourne. He is a member of the World Health Organization panel of experts on mental health and substance abuse, and has been since 2007, and he was appointed by the Director General of the World Health Organization. Professor Minas is a development partner and technical advisor of the ASEAN Health Cluster, visiting professor at a university in Indonesia, and a distinguished fellow at the Pacific Rim College of Psychiatrists. Please join me in welcoming our keynote speaker today, Professor Hayriye Minas. Professor Minas, I might just ask you to put yourself on, or unmute yourself, as we can't hear you at the minute.
My apologies. You'd think I'd know how to use Zoom by now, given what we've been through over the past few months. Thank you very much, Hayriye, for the introduction. And thank you also to the Mental Health Foundation of Australia for inviting me to participate in this forum. This is an issue that has exercised many of us over a very long period. The question of how can our mental health systems actually respond to the diversity of Australia, the well-known, much acknowledged, highly valued, at least rhetorically, diversity of Australia. What I'd like to focus on in this presentation, if you could turn on the slide for me, please, Hayriye. I've only got one slide that I'll be using. I'll be taking a mental health systems kind of perspective on discussing this issue of mental health services for immigrants and refugees, because I think the question of the capacity of our mental health systems to respond to that diversity is one of the most important issues that we need to look at. Let me start with the right-hand side of the slide, and that is service users, people with mental health problems, their families and communities. And what are the outcomes that we look for from our mental health system for those with mental health problems, those around them, and the broader community? One of the first issues is whether the services are accessible or not. Do various communities, do subgroups within the population use services at the same rate or not? We know from work that's been done for a very long time that many immigrant and refugee communities very substantially underuse services, despite the fact that they probably don't have lower rates of mental health problems or mental disorders. Are the services safe? If people can't speak the language fluently, if they have very different cultural understandings of mental health and illness, is it more likely that clinical errors will be made? I think the answer to that is yes. Are the services appropriate? Do they meet the needs of people who come from different backgrounds? Again, I think the answer to that is probably no, not to the extent that we would like. Are the clinical outcomes the same for immigrant and refugee patients as they are for everybody else? We don't know, because there is no reliable data on this. And are the social outcomes, employment, success in education and so on, as good for immigrant and refugee communities as they are for the rest of the community? Probably not. We don't have time to go into that kind of detail. What I'd like to focus on is the mental health system and its capability. One of the key problems that we have is the limited research and information about mental health amongst immigrant and refugee communities, and about the issues of clinical outcome and other important factors. Governance and leadership of our mental health systems. Our systems are essentially designed for a monocultural, monolingual society. There is very little effort to actually design a system that is fit for purpose for a very diverse community. There is very little in the way of financing for programs that would improve the situation for people from immigrant and refugee communities. And our workforce is not adequately trained in order to be able to function competently when they are confronted by people from different cultural backgrounds and who may not speak English. So when we look at the services and how they respond to cultural diversity in their communities, do they meet these criteria? Are they efficient? Are they responsive to the particular needs of people that they serve? Are they equitably distributed? Are they of high quality for everybody in the community who requires those services? And are they sufficiently flexible to be able to respond to diverse needs and preferences amongst different communities? Unfortunately, I think the answer to many of those questions is no. In Victoria, we're in the midst of a Royal Commission into the Victorian mental health system. The Commission in its interim report described our mental health system as broken, and it requires very substantial reform and redevelopment in order to be able to provide the kinds of services of the quality that everybody in the community has a right to expect. And in my view, one of the fundamental problems that we have is in this issue of engagement, collaboration, and co-creation. To what extent our immigrant and refugee communities are involved at governance and leadership levels, decision-making levels? To what extent do they have the opportunity to influence how programs or services are designed, the way they're run, and the way they're evaluated? And I think what we need to do is to actually support communities to become much more involved at every level of the mental health system to ensure that it's fit for purpose. So I think there is a program of reform that needs to be pursued that recognizes diversity, responds appropriately to it, and is of benefit to people from immigrant and refugee communities. We're a long way from that, but I think we should be working as hard as we can to shift the system in that direction. Thank you.
Thank you very much for your insights, Professor Minas. And I think we've all taken away a lot of information from your presentation. And I saw a number of people actually asking for the notes from this presentation as you spoke. So thank you for sharing your insights. We want to also extend our appreciation to you for your support towards National Mental Health Month. And in ordinary times, we'd be handing you a small gift, but we will be posting a small token of our appreciation to you. I'd now like to invite our next esteemed guest, Professor Sev Ozdowski. Professor Ozdowski is the chair of the Australian Multicultural Council. He is the Vice-Chancellor's Fellow at Western Sydney University and Adjunct Professor of the Department of Peace and Conflict Studies at the University of Sydney. He was the Australian Human Rights Commissioner and Disability Discrimination Commissioner at the then named Human Rights and Equal Opportunity Commission from 2000 to 2005. He has also headed the Office of Multicultural and International Affairs in South Australia for 5 years and is the immediate past president of the Australian Council for Human Rights Education from 2006 to 2019. Professor Ozdowski was recognised through various Australian and international honours, including an Order of Australia Medal in 1995, and was appointed as a member in the General Division of the Order of Australia in 2016. Professor Ozdowski previously served as the chair of the Australian Multicultural Council from 2014 to 2017. Please join me in welcoming Professor Ozdowski.
Well, welcome everyone. I hope you can hear me, and thank you very much for this generous introduction. Allow me to start by acknowledging the traditional owners of the country throughout Australia and pay my respects to the elders past, present, and emerging. Now, allow me also to say thank you to the Mental Health Foundation of Australia for the opportunity to address this forum. And I commend the foundation on its National Health Month campaign. There is no doubt that mental health is a top priority during the global pandemic. Allow me also to acknowledge Vasan Srinivasan, who is my colleague on the Australian Multicultural Council, for taking the initiative to organize this important webinar. As Australian Multicultural Foundation Chair, I'm pleased to report that during the pandemic, the Australian Multicultural Council met regularly with Alan Touch, our Minister for Multicultural Affairs, to provide advice about unique challenges facing Australians of culturally and linguistically diverse communities, or I will call them CALD for short. We regularly spoke about the mental health issues. But my involvement with mental health goes back to my days as Human Rights Commissioner and Disability Discrimination Commissioner. In 2005, I published a report, Not for Service, Experiences of Injustices and Despair in Mental Health Care in Australia. The report was produced together with Mental Health Council of Australia and with Professor Ian Hickey of Brain and Mind Research Institute in Sydney. It was based on 6 months long Australia-wide inquiry that included consultations, public submissions, and academic research. It resulted in over 1,000 pages long report that demonstrated a range of failures in mental health system and suffering that resulted from it. The government, to the report, brought structural improvements to mental health services, including opening of Medicare to payment for mental health consultations. Much remains to be done, as previous speaker said. My today's remark will focus on multicultural mental health in general and on tackling the mental health issues in multicultural communities. Let us first look at some data. Since March 2020, mental health services have been reporting a significant increase in online traffic, phone calls, and web chats due to the coronavirus. Till October 2020, the COVID support pages on the government Head to Health Gateway received close to 400,000 unique page views. In the same period, some 8 million mental health services have been delivered nationally by Medicare, including over 2.5 million services delivered by telehealth. When you look at cold communities, the communities include refugees and other migrants who had to overcome huge obstacles during the resettlement period, and who some of them are recovering from effects of torture and trauma. Cold communities can also face additional mental health challenges. They may find it difficult to use mainstream services because of language and cultural barriers. They may be confused about how services operate, or simply may be unaware of a range of services available. Therefore, additional support is needed, and as part of government's contribution to National Mental Health and Wellbeing Pandemic Response Plan, funding was provided to support enhancements to Head to Health service to ensure that it's accessible and relevant to multicultural communities. And the additional resources provided include 1.1 million through Primary Health Network to support enhanced delivery of targeted mental health services to cold community, linkages to translating and interpreting service on crisis page, identification and filtering of digital resources available in other languages, and also development of new content for web pages. More recently, the government has invested more than 26 million to establish 15 mental health clinics across Victoria, and these clinics provide additional support for those more disadvantaged in our community, and this includes people of multicultural backgrounds. Key mental health support information is also available in over 60 languages on the Department of Health website, but also SBS, Beyond Blue, Kids Helpline and Lifeline provide translated resources. In addition, the Australian Government Department of Health is funding Mental Health Australia by 3.9 million over 3 years to provide a national focus on mental health and suicide prevention for people from cold background through Embrace framework. And Embrace framework is a national platform for Australian mental health services and multicultural communities to access resources, services, and information in a culturally accessible format. It can also help organizations and individuals to evaluate their own program and their own delivery of services to cold communities. In closing remarks, allow me to say that forums like this are vital for understanding and sharing views about multicultural health. And I look forward to sharing experiences around of what is working, what is not, and how we can make a difference. Thank you.
Thank you very much, Professor Ozdowski. And also thank you for your support towards National Mental Health Month's awareness campaign this year. It's greatly appreciated. And as a gesture of our appreciation, we will be posting a small token of thanks to you.
Thank you.
I would now like to welcome Ms. Vivian Nguyen. Vivian is a passionate advocate for diversity and multiculturalism with more than 25 years experience in the corporate, public and community sectors. She was previously the president of the Vietnamese community in Australia, the Victorian chapter, where Vivian played a key role in advocating for Australia's first Vietnamese cultural museum. She commenced as the chairperson of the Victorian Multicultural Commission in August 2019. And at the Department of Health and Human Services in Melbourne City Mission, she supported the disability sector's transition to the NDIS. Prior to Vivian's work in the public and community sectors, she held roles at the Ostchoice Financial Services, AMP Asset Management, and ANZ Banking Group, where she led the global organisation's diversity strategy. Vivian was awarded the Australian Centenary Medal in 2003 and was recorded on the Victorian Honour Roll in 2002 for her services to community advocating for women in leadership and for Vietnamese young people. Please join me in welcoming Ms. Vivian Nguyen.
Well, thank you very much for that warm introduction. Good afternoon, and thank you for the opportunity to join you today for this very important Multicultural Mental Health Forum. I would like to begin by paying my respect to the traditional owners of the land on which I speak today, and to pay my respects to elders past and present, and celebrate the diversity of Aboriginal and Torres Strait Islander peoples and their ongoing cultures and connections to the lands and waters of Victoria. I would also like to pay my respect to any Aboriginal people who are attending this event this afternoon, and a special acknowledgement to Mr. Has Mustafa, Director for Mental Health Foundation Australia, Professor Hayriye Minas, Head of Global and Cultural Mental Health Unit, Centre for Mental Health, Melbourne School of Population and Global Health, University of Melbourne. That was a very long title, and I'm so glad I got it through. Ms. Nancy Huang, Chief Medical Advisor for Australian Unity. Dr. Zev Ozdowski, Chair of the Australian Multicultural Council. Ms. Sonia de Metza, Deputy Chair of the ACT Multicultural Advisory Council. And Dr. Edwin Laws Joseph, President of the Multicultural for Northern Territory. On behalf of the Victorian Multicultural Commission, I congratulate and thank the Mental Health Foundation of Australia for organising this important forum to talk about multicultural mental health in Australia. You know that this pandemic has highlighted the importance of mental health and the current services available to multicultural communities. But it's not just the number of services available that are important, it's also the access points. And many people from culturally and linguistically diverse communities can experience a number of unique challenges when accessing the mental health system. And we need to explore how to address this. These challenges are complex and include stigma and discrimination, misdiagnosis, services that are not well equipped to respond to multicultural communities' needs, language barriers, limited awareness of supports available, and trauma experiences. In many cultures, mental health is not spoken about, and in some countries where our communities have come from, certainly including mine, mental health services are limited, if not at all existent. More work needs to be done to ensure services are accessible to all. I have seen how community organisations and faith groups have been vital in advocating and supporting for mental health of the community. But these networks are not currently recognised or incorporated into the system. More needs to be done here also. Changes that are needed in the system and the Royal Commission into Victoria's mental health system will play an important role in identifying these opportunities and implementing positive actions. I will continue to advocate for greater access to the wide range of quality mental health services that are available and continue to empower all communities to achieve good mental health. I support the work of the Australian Mental Health Foundation and its many multicultural ambassadors and do look forward to continuing this collaboration and this partnership. Thank you and enjoy the rest of the forum.
Thank you very much, Vivian, for your insightful and engaging address, and also for your support towards National Mental Health Month Awareness campaign this year. We will also be posting a small gesture of our appreciation to you. I'd now like to welcome our next esteemed guest, Ms. Sonia de Metza. Sonia is the Deputy Chair of the ACT Ministerial Advisory Council on Multicultural Affairs. She's a human rights lawyer and has worked as a refugee lawyer in Australia, has set up and managed human rights projects in Pakistan and Sudan, has worked for the United Nations High Commissioner in Lebanon as a resettlement consultant, and worked for a local child labour rights NGO in India. Sonia holds a Master of International Law with majors in human rights law. She was a career representative on the Mental Health Australia's Mental Health in Multicultural Australia Consumers and Carers project. Please join me in welcoming Sonia.
Thank you for that warm welcome. Good afternoon, everyone. My name is Sonia de Metza, and I'm the Deputy Chair of the ACT Ministerial Advisory Council on Multicultural Affairs. I also want to acknowledge the traditional custodians of the land on which we meet all over Australia and here in Australia for the Ngunnawal people, and pay my respects to their elders past, present and emerging. To start with, I'll provide an overview on general mental health concerns, including access to services, mental health literacy, employment and family and youth, as well as some possible ways forward to address these concerns. Then I'll talk more specifically about the COVID-19 pandemic and some of the problems that have emerged. I also offer examples of some ways the ACT government, working with the council, have attempted to close some of the gaps around COVID-19. Access to services. It's our observation that mental health in the ACT has been neglected for some clients who are compelled to travel to Sydney in order to see a mental health professional. Sometimes people have to wait for 8 months for support, which is very problematic. We furthermore have observed that people from a cowed background experience a significantly lower level of access to mental health care and support compared to the wider community in the ACT. For many cowed people, English is a second or third language. They need better dissemination of mental health information across all multicultural communities, including translation in the key languages. Mental health literacy. Mental health literacy is generally considered poor amongst the multicultural communities. Part of this may be explained by cultural stigma that the communities may experience, meaning that discussion of mental health issues may be considered culturally taboo. We recognise that community leaders in ethno-specific communities and religious communities have a key role to play in educating their members about mental health. Employment. Some of the sources of mental health challenges in the ACT amongst the cold populations include not having employment, including opportunities to work in the Commonwealth or ACT public service due to lack of citizenship or permanent resident status. Families and youth. In relation to young people from cold backgrounds, people are becoming particularly anxious around the Black Lives Matter movement. One council member reported an increase in division between students at an ACT school as a result of the Black Lives Movement protests. Cultural identity amongst young people is an issue. For example, a couple of Muslim families in the ACT have teenage boys who are starting to enjoy themselves, party a bit and drinking with friends. This has caused family breakdowns as well as stress and anxiety for young people. We are furthermore seeing some single parent cold families with younger children being compared to take on the adult male role by supporting the mother and younger siblings to ensure that bills are paid on time and groceries are purchased, etc. This particular teenager in question has spoken about not being able to sleep well at night and experiencing headaches. Sometimes school counsellors in the ACT refer a few young people from refugee backgrounds as they do not feel that they have the right level of skills to work with these young people who have experienced significant trauma from their country of origin. The way forward. There is hope in initiatives such as the National Disability Insurance Scheme Community Connectors Program. I myself am helping to support advocacy for inclusion and other actors in the ACT with this program, which provides information to CALD communities about the NDIS, including support for people with psychosocial disability. Some solutions to these challenges may include increasing the capacity of existing transcultural mental health networks to address the existing mental health gaps. Too many volunteers are used in the CALD context, which is unsustainable. Another solution is to organise face-to-face visits with older people from CALD communities to ensure that key mental health issues are conveyed, including where they can seek support. Creating more innovative ways for including CALD youth in the community, including more sporting opportunities, can help decrease the likelihood of mental ill health arising. Turning to COVID-19, the mental health situation of the CALD communities has been exacerbated by the COVID-19 situation. Older people from CALD backgrounds who are being forced to self-isolate as a way of protecting themselves are feeling increasingly socially isolated and becoming depressed as a result. They are not receiving information about ACT-specific situation in their languages and need more people checking in on them regularly and making sure that they are well. We've witnessed a significant number of people present with mental health issues related to a loss of employment. This has resulted in people feeling stressed and anxious about how to financially sustain their families, feeling shame and embarrassment at having to ask for support from organisations. For people from CALD backgrounds on temporary visas and who are ineligible for Centrelink benefits, they are feeling particularly vulnerable and their mental health is deteriorating as a result. There is also a sentiment of fear and anxiety relating to the virus itself. Mainstream mental health services don't appear to adequately support our CALD clients, and they are not culturally appropriate at times. Some CALD people are reporting that some of the available mental health services and supports can be quite intimidating for them when such services don't exist in their countries of origin. The ACT response. While the Council nor the ACT government has been able to address all of these concerns, a number of initiatives have attempted to provide support. The ACT government, for example, immediately increased the quantum of translations and information provided. COVID-19 information is provided in up to 13 key languages. This has resulted in a critical friends group advising the government on information being distributed. Most recently, a collaboration between ACT Health and the Multicultural Council resulted in a webinar between the Chief Health Officer and multicultural community leaders in the form of a question and answer style forum for information to be directly shared face-to-face. Ongoing initiatives to ensure communities are supported are emerging from this initial work. In terms of temporary visa holders and international students, the ACT government committed $450,000 in support. Existing service providers such as Companion House and Red Cross, etc., administered and distributed funding based on needs. So our response to COVID-19, as in many states, has demanded that we improve. Our hope is that in going forward, the lessons we have learned and improvements we have had to make in sharing information around COVID can extend to, for example, mental health. The CHO webinar is indicative of this, as is the Critical Friends group. Thank you for listening.
Thank you for your engaging and informative address, Sonia. And we thank you for your support this year again with National Mental Health Month awareness campaign, and we'll be posting out a small token of our appreciation to you as well.
Thank you.
I'd now like to welcome Dr. Edwin Lourdes Joseph. Dr. Edwin Lourdes Joseph is the President of the Multicultural Council of the Northern Territory and is passionate about serving the community and being active in public life. His experience is multifaceted, working for private and public sectors, including roles in education, HR, project management, community engagement, research, policy, and so on. Having migrated to Australia as an adult, Edwin understands the problems faced by community and linguistically diverse people in Australia. He is also active in the refugee space, volunteering with the Red Cross, Uluca Refugee Centre, and DASAN, which is the Darwin Asylum Seeker and Advocacy Network. Throughout his life, Dr. Edwin has been volunteering for community groups, not-for-profit organisations and professional associations, often with leadership positions. He also serves on the Northern Territory Division Boards of United Nations Association of Australia as the Treasurer, and Dasan as the social media admin. He serves for the Institutional Public Administration Australia and the Australian Computer Society and the Australia Day Council as the Vice Chair. Edwin is also the Multicultural Ambassador in the Northern Territory for the Mental Health Foundation in Australia. A very full CV, much like all of our esteemed guests today. Please join me in welcoming Dr. Edwin Lourdes Joseph for his address today.
Thank you, Hayriye and the Mental Health Foundation of Australia for inviting me. And good afternoon, everyone, fellow panelists and other viewers. I would like to begin by acknowledging the Uluca people, the traditional owners in the top end of Australia. So I am speaking from Darwin, the top end, the capital of Northern Territory, the remote state of Australia. So when migrants move to Australia, they definitely need a visa, but microorganisms can enter Australia without a visa. And that is how we have got COVID-19. The impact of COVID-19 pandemic means different things to different people. It took toll on everyone in the universe, but for migrants, it added extra difficulties. We have seen many international students who moved to Australia, who came here to study with a dream of settling in Australia, and they were relying on funds that they can earn from part-time jobs. And most of them have lost their jobs and they are struggling to pay their next semester. It wouldn't happen to someone who is not a migrant. And also we are thinking about the temporary visa holders who lost their jobs. They don't have any social security payments. They are not eligible for job seeker. They are not eligible for job keeper payment. What would they do? There are so many people who went for holidays back home and they are not able to return because Australia has put the temporary the travel restrictions. And some of them are paying rent for the home in which they don't live, but they have got assets there and they are overseas, they can't vacate their home. So these things add very extra difficulties to them, which the mainstream Australians can't think of because they are not affected in that way. And apart from that, even for some of the people who are the permanent residents and who are the citizens here, who are from the migrant background, they also face extra difficulties because they have got, I know a few cases where the parents died and they couldn't go because of the restriction, because of the, there are no flights. And it adds extra burden for a person in the Northern Territory and in a place like Darwin, because it's not Sydney or Melbourne. They don't have flights. Even otherwise, the flights are not good in number, but because of this pandemics, the number of flights have been reduced a lot. And there are so many people who couldn't go when the parents died or someone fell sick, they couldn't go. So they are here, which even though they get job keeper or job seeker payments, or they have got jobs, there is a social commitments, like a family commitments they couldn't fulfill. And this is only for migrants, which the other people don't face much. So the effect of this separation causes social isolation and alienation, which has negative impact on their mental health. And there are so many people who are approved for visas, but they are also not, and they resigned their jobs, they are overseas, but they can't move to Australia because of these travel restrictions. And when I said about the NT, I'm not sure how many of you are familiar with the demographics of the NT. NT in size, it is a bigger in size, maybe bigger than New South Wales and Victoria put together, but it is just 1% of the whole Australian population, just 1% of the whole Australian population. And half of the population lives in in Darwin, the capital city. So the rest of the NT, you know how remote it is. So I have done road travels down south and in the NT. The road travel here is entirely different. You can't see people for like 100, 200 kilometers. And then only you will see some petrol station or something like that. So what will happen to these people when these things happen? It's really hard. And especially think of a migrant who is in one of the remote communities, remote indigenous communities in the NT. They might have gone there for work. What will happen to them? They may not have a social or like family support there. And things like this happen and they are left in like limbo. Darwin, very small by population. It has got 1% of the Australian population, but you can say that it's very multicultural. So many people are here. So many people from different ethnicities are here. As you know, the national average of indigenous people is like less than 3%, but in Northern Territory, it's more than 25%. So indigenous population itself is somehow culturally and linguistically diverse from the mainstream Australians. On top of that, we have got migrants from several countries who are like 5 or 6 generation like Greek people and the recent migrants, first generation migrants like me. So we form another more than 20% of the NT population. So nearly 50% of the NT is, we can say, multicultural population. And the well-being is the like not well prioritized, or I can say it doesn't been given like due priority in any of the government policies. I'm happy to hear from Dr. Huang about the well-being index, national well-being index. I would say such indexes should be incorporated into the human development index as well. Because if you see the world level of world categorization of human development index, which is the most accepted form of categorizing a country as a developed country, Australia ranks 6th in that human development index. But does that consider the mental well-being? No, it needs to be considered. So Dr. Huang said the mental well-being affects the lifespan of people. The lifespan is considered as one of the factors leading to the human development index, but it doesn't always reflect that. There are people who live in agony or the trauma for the majority of their life, and still that is not taken into account. That's why we need this well-being index. And in NT, if you see the mental health issues, that is also more than the other parts of the Australia. So NT has got the highest rate of burden of disease in Australia, and especially mental health disorders cause 16% of the mental health issues and illnesses in the NT compared to 7.4 national average, 7.4% national average. So according to the Northern Territory Primary Health Network, NT residents experience the 2nd highest rate of mental health related emergency department visits nationally. In the NT, mental illness is often underreported or underdiagnosed, partly due to a lack of services funded to respond to mental health issues among the Aboriginal population in a culturally sensitive and a specialized manner. So last year, 6 focus groups have been conducted in Darwin and Alice Springs. Alice Springs is the 2nd largest city in town. Sorry, city is not the right word. 2nd largest town in the NT. So 6 focus groups conducted last year showed evidence of general migrant experiences that are likely to affect their mental health in the following ways. One is a language barrier that is very evident. There are people in the NT who still speak, who were born in Australia, who were bred in Australia, but they don't reflect the mainstream Australian culture. They are born in remote communities. And for them, English is a second or third language. Some of them don't even speak English to the extent the migrants do. So the language barrier is one of the things. So there should be the language specific awareness programs aimed at those people. The second thing is current family connections. So economically, we get benefits like if you are a citizen or permanent resident, we get many benefits like other mainstream Australians. But as the last speaker, Miss Sonia Dimersa mentioned, the current family connection is a big factor because people are that I have witnessed personally in many of the migrant families and communities. It is a matter of research, but in research it is not identified. But with the lived experience and seeing people, I could say this is one of the things that is causing mental health problems because people come with a different culture in the way they upbring their families with their kids. Like, for example, there are cultures, most of the developing country cultures, most of the third world country cultures, most of the cultures do not permit drinking, especially or having to choose their partners is not allowed in many of this culture. And what happens is the parents come there with the culture back home and they do everything for the kids, but the kids, they are brought up in a different culture. It ends up like, when the parents stop, it ends up even legal issues, going to police and other issues. And many of the people, aging population of the migrant parents, they are very depressed and they are left unsupported. So the current family connection is the second factor identified in the focus group thing. And the third one is factors that helped or hindered with the settling in period. That's for the new migrants. Like, as I mentioned earlier, about the international students and the temporary visa holders, they are in this stage and they face this extra difficulty. And the other factor is main barriers to establishing self, and other factor is establishing their family. Some people get job, they establish themselves, but with their family, they struggle to establish. And there are also the feelings of homesickness, belonging and attachment with an identity crisis and other things. And there are the people who come with a permanent settling, they have migration intentions and the visa and other issues that also cause them issues. So this is the recent research held last year. And I could totally agree with that, my lived experience and what I gained from the community and other people. So what NT needs in the multicultural scene? It's not only NT, the whole Australia. Some of the things that I said applies to the whole multicultural population in Australia. The first and foremost thing is to create mental health awareness to people of multicultural backgrounds about mental health. Because many of the migrants do not have that awareness because they come from people from developing countries. They come from a different competitive culture and the lifestyle where they struggle even for their economic needs. So the mental health is given less priority. So they don't really have a chance to think about their mental health. And am I running out of time?
I'm so sorry, but we are racing to the finish line, and we do need to get to our panel discussion. And perhaps we can engage with you for some more discussion through that process.
So this is the one. The second thing is providing services by the federal and territory governments that extends to the remote communities in the NT and the multicultural population in the NT. And also I would like to emphasize everyone, it's not only depending on the government, please provide peer support to your people in your communities and in helping to promote these programs to the people in your community. And thank you very much for your patient listening.
Well said. Thank you very much, Dr. Edwin. And also we are very grateful to you for your support throughout the month and for your contribution today. And we'll be posting a small token of our appreciation to you.
Thank you. Looking forward to that.
I do want to now move to the next segment of our discussion today. We are a little bit short of time, and I do appreciate that some people are logging on their lunch break from work. So I want to now introduce our panel, and this consists of our speakers today. So firstly, I'll welcome back Professor Hayriye Minas, Professor Sev Ozdowski, Ms. Sonia Demetsa, and again, Dr. Edwin. Thank you for joining us for a panel discussion. We've heard from each of you about your insights from your professional and also some of your personal experiences. And I want to direct some specific questions to you that have been formulated and people have asked us ahead of today's session. So Professor Minas, perhaps if I could start with you, from a research perspective, what should the future research direction in multicultural mental health be? There may be some examples that you can give us about research-driven mental health programs that have supported culturally and linguistically diverse communities that have been implemented and have been effective. What do you think the future direction of research in this area should be?
I think I'd like to broaden that out a little. So research is one component, but the other is information. So the kinds of information that is routinely collected by clinics, hospitals, emergency departments, and so on. One of the difficulties is that information often doesn't include the kind of variables you need around language, language fluency, around cultural issues that can allow you to look at how immigrant and refugee communities are doing compared to the broader Australian-born community. Even where it is collected, for example, the Victorian mental health services collect a lot of information on country of birth and related variables, but that is never analysed and it's never separately reported. What that means is that there is a lot that we don't know about how immigrant and refugee individual users of services or communities overall are doing. That's one of the first things that we can do, and it would be a very easy thing for health departments in each of the states and territories, for the Australian Government Department of Health, for the Australian Institute of Health and Welfare, to disaggregate that data that is collected so that we actually know how different communities are tracking. In terms of research, some years ago, we developed a research agenda for multicultural mental health. That is available, hasn't been taken up really, and there are a whole lot of areas that we need to look at. Let me just use one example. Suicide is a major issue in Australia. There is an enormous amount of money, Commonwealth and other money going into suicide prevention programs, but we have no idea about whether those programs are reaching core communities, whether they're having any impact, whether those communities are deriving any benefit. Because like the rest of mental health services, those programs are not specifically tailored for those communities. So there are many areas in which we can improve the information. That lack of information means that inequities remain hidden. So I think that question of information is absolutely central to improving the way that our mental health systems function.
Thank you. And I think that sort of relates to Sonia's points a bit earlier about tailoring the information to CAL communities. And perhaps, Sonia, you can elaborate on that, about how we can better tailor information to CAL communities. Is it about simpler language? Is it about more appropriate translations? Is it about engaging with communities and action planning with them about what it is that they need and why certain services are not actually being accessed, where the barriers lie?
I think SBS did some research into this in Sydney, I believe, and the feedback they were getting from many of the CALD communities is that the best way to communicate information on relevant issues is face-to-face in a language that the person understands. Now, we know in reality this is quite costly, but this is the ultimate means of communication that we aim for, and that we should try and achieve. And the way to do that, I think, is to find champions in the community, people who understand English, understand the community language, and are able to work effectively amongst the community and explain what those key messages are.
Thank you. And I suppose that highlights the additional challenge we have now too with the face-to-face, given that we're trying to enter a COVID-safe environment in the wake of COVID-19, particularly in Victoria. So, you know, it does seem to present an added layer of complexity as well.
Absolutely, because also the uptake on information technology amongst CALD communities, particularly, for example, older members of the CALD communities, is a lot less than the general population. So we have to find more innovative ways of reaching people who have to, you know, isolate from others.
Absolutely. Thank you. I want to pose a question to Professor Ozdowski. Given that you've worked with many cabinet ministers in your role, in your opinion and given your experience, what is the government's direction or perhaps plan when considering how it will improve mental health and access to support services for people struggling with mental health issues?
I personally think that the pandemic provided a unique opportunity for putting additional resources into mental health. But quite much of resources which were put, they were put in a relatively short, for a relatively short time frame, so for a year or for 3 years, and they are likely to disappear, especially when the government will start working our budget again to return to black. I can see many services disappearing. I think the importance of organizations like yours and other mental health organizations is really to secure the funding in a longer run and to argue with the governments where really the priorities are in terms of changing circumstances. And I possibly would suggest that it won't be able to keep everything, but I think it'll be possible to keep the money which will be best targeted in terms of needs and outcomes.
Thank you. I want to go back to Professor Minas again, who you mentioned earlier on that the system is broken and that it's designed for monolingual communities and that we're not really flexible enough to deal with the complex needs of CALD communities. And you also touched on the Royal Commission. I wonder what your thoughts on that are on the Royal Commission and what you'd like to see in terms of recommendations that come out of that, or perhaps what you expect some of the problems that might be revealed throughout that process, throughout the Royal Commission.
The Royal Commission has got a range of very specific recommendations to do with mental health services for CALD communities. They're very detailed. They come from a variety of sources. They rely on good information, and they come from organisations that have been working in the field for a very long time and know what the situation is. The interim report of the Commission was very disappointing in that it didn't do anything very much about that. It's my understanding that the final report will contain some attention to this, but it remains to be seen how much attention is given to this as an issue. In my view, the only way that we will get substantial and sustained reform in policy, in service design, in the way that services are delivered, in the training of mental health professionals, is to have an independent body that is focused on this issue, that remains in place, because this is a long-term program of reform that we're talking about. It will, if it happens, it will happen slowly. And so we need something like an Australian Institute for Migration Mental Health. We need something that is capable of both critically reviewing existing policies, reviewing, for example, to what extent are people of immigrant and refugee origin in decision-making roles within the health departments? To what extent are the evaluations of the mental health system taking into account whether the mental health system is actually producing benefit in immigrant and refugee communities? So I think that without that kind of independent body that has sufficient capacity to be able to hold government to account when it rhetorically states its commitment to multiculturalism, I think the likelihood in the next 10 and 20 years is likely to be the same as the past 10, 20 or 30 years, where governments have consistently said they are committed to this issue, but then have done next to nothing in order to implement.
Thank you. I think that those are really important insights that you've given us. And I think what's really great about these types of forums is that we can then collect information and insights, and so that we as an organisation know how we can advocate for reform and influence change, and perhaps write to government in support of some of the suggestions that you've made. So thank you very much for your suggestions. I want to, before we wrap up, I do want to give an opportunity to anyone else on the panel to provide their opinion about what else needs to change to better support migrants with their mental health when they first arrive in Australia. And then I will pass it over to our director for a vote of thanks.
Can I just say something? I think that it's important to acknowledge that a venerable organisation like the Mental Health Foundation of Australia, which has been around for 90 years and is an influential organisation, the fact that it has taken on the issue of multicultural mental health in itself, I think, is an important advance. And I think the more strongly the foundation can be supported in pursuing the reforms in this area, the more likely we are to get some movement.
Absolutely, thank you very much. And I think one of the strengths of the organisation is how deeply connected we are through the Ambassador program to our respective communities, and can bring insights, nuanced insights to the table, to the discussion, and then go back to the community and disseminate information as well. So I do think that we've got some valuable insights from today also to push forward and advocate for some reform. So thank you very much to all our panellists today for your preparation and for your attendance and engagement with this really important discussion. I'd now like to welcome Ms. Helena Kyriazopoulos to give the vote of thanks for today's event. Helena is the board director at the MHFA and has over 35 years experience with the ageing and multicultural sectors. She has a degree in business, industrial law, and is a member of the AICD. Helena worked for Alzheimer's Australia, South Australia for over 22 years as the Access and Equity Unit Coordinator and Secretariat for Alzheimer's Australia. She also undertook social research in the areas of carer and ageing needs, and is the current CEO of the Multicultural Communities Council of South Australia. She's also a member of the Australian Multicultural Council and sits on a number of boards, including the Council of Ageing South Australia, Welcome to Australia, and is part of the Health Consumers Alliance. Please join me in welcoming Helena.
Thank you so much, Hayriye. On behalf of the Multicultural Health Foundation of Australia, as one of the directors, I would like to thank all of our speakers for their presentations today. And thank you also to the sponsors, the Department of Health and Human Services, Australian Unity, Vic Health, Mental Health Victoria. All presentations were very thought-provoking, and I actually have some takeaways from today's presentations. And if you just allow me a couple of minutes, the key points for me were the limited research around ethnic communities and mental health issues. Also, that we need to ensure that people from ethnic communities are included in every discussion that we have around mental health. The lack of mental health literacy amongst core communities. Stigma is so very real still in our community. the need for culturally and linguistically appropriate services. It's surprising that the year 2020, we're still talking about this, and also the need for appropriate data collection related to CORD and mental health issues. I just can't understand why we're still talking about these issues in this present time, but as a foundation, I think we have taken these on, and we will continue advocating that we can actually rectify some of these issues along the way. Finally, I would also like to say well done and thank you to the Mental Health Foundation Australia team. They have been working tirelessly over the last 10, 15, 18 days, and there's a few more up their sleeve before the month is over. It's an enormous task to undertake all these, and particularly with the National Walk. Thank you all in the team, and thank you to my fellow directors and to the chairperson, and thank you everybody for joining us today.
Thank you.